Oklahoma City claims a distinctly American heritage rooted in agriculture, energy, and manufacturing. However, its location at the intersection of two major U.S. interstates puts Oklahoma City at an unfortunate collision point in the country's epidemic of prescription drug abuse.
We believe in Oklahoma there's around 300,000 Oklahomans that have a prescription drug issue. More alarming even than that is that we were ranked #1 by the CDC year before last for prescription drug use in 12 years of age and older. And then alarming to me, each one of the drug overdose deaths are reported to me at my office every year annually. And we are #9 in the nation for drug overdose deaths. They've skyrocketed in the last 11 years, 137%. That's a lot of statistics, but what it tells us is that we've got a silent cancer out there, and it's prescription drug deaths, it's prescription drug abuse.
You know, as a provider, that we're seeing so much of this activity and so much of our effort is being spent trying to understand whether or not I should prescribe this patient or not, instead of doing what we were trained to do, which is take care of patients. When we have a resource like the Prescription Drug Monitoring Program in Oklahoma that is bringing you real-time data from the pharmacies, it's a tremendous asset.
In January 2012, Oklahoma became the first state to require pharmacies to submit controlled substance data to the Prescription Drug Monitoring Program at the point of sale. Recognizing the value of this real-time data, the Office of the National Coordinator for Health Information Technology and the Substance Abuse and Mental Health Services Administration sponsored a pilot study to streamline access to PDMP data at the point of care. Providers, state agencies, and health IT vendors partnered to design a model that would leverage a health information exchange known as SmartNet for delivery of the information to providers across the region. Chief Information Officer from Oklahoma Heart Hospital, Steve Miller, explains the evolution of SmartNet.
That's probably the #1 thing that we've done as we looked at our early adoption of SmartNet was a portal-based technology where physicians would go out, they'd log in through a website and consume that data through a separate login and password and so forth. And although it was super, we really found that physicians were hesitant to use that. And once we took the approach of integrating it inside our EMR in such a way that would work not only inside Cerner, but also inside Meditech and also inside Epic and some of the other providers, that really changed the ballgame for us. The ability for a physician to be in his workflow, inside the patient's chart, and click one button and see all the data about that particular patient across the state.
3 care facilities participated in this pilot, each using a different electronic health record system. Once the provider has signed into their EHR, they can select the patient they are treating. Within the patient's chart, there is a link to access the patient's community medical record via SmartNet. The systems work together to authenticate the provider credentials and populate the patient record without additional logins. SmartNet searches participating health record systems across the region and builds an aggregated view of the patient's medical history. The pilot design also allows for a simultaneous query to the PDMP that would return a controlled substance history for the patient. An alert feature would signal to the provider when a patient has filled enough prescriptions to reach a threshold of concern. At any point, the prescriber could select the PDMP link to view the full report.
I think what's most exciting about this project is the clinical impact and the relevance in healthcare in terms of patient safety and quality, and that ability to partner with law enforcement, with our state, and with the Prescription Drug Monitoring Program to tie these pieces together in workflows where we can do more to address this problem on the front end rather than in a most expensive way trying to recover from that with law enforcement on the back end. I think it's a great way for Oklahoma to showcase exactly what we're doing that's innovative in healthcare.